Another intervention that we have talked about extensively over the last year is convalescent plasma. And while there was some initial data that seemed to show promise, especially in high-dose antibodies given early in the course, it seems as though the final nail in the coffin, if you will, shows that convalescent plasma does not work, and it is being dropped from many protocols for the treatment of COVID-19. And this was a randomized controlled trial of 228 patients where they were given fairly reasonable titers of convalescent plasma, and they looked at the clinical status of these patients and mortality, and there was no difference in mortality statistically significantly. It was 10.96 versus 11.43. And here you can see with the time on the x-axis and the probability of death on the y-axis, with red being the intervention, convalescent plasma, and blue being placebo, that there was no statistical significant difference between those two groups. And furthermore, here in terms of a probability of clinical improvement or hospital discharge, you can see here that there was no statistical significant difference here at day 30. Another one of the treatment possibilities that we talked about early in the course, especially in our update 46 and 47, was the potential use of hydrothermal therapy and whether or not a fever should be treated in COVID-19. And I'm happy to report that that theory has been codified scientifically in a paper that was published in Medical Hypotheses with experts out of Finland, where saunas are used quite often, and California, specifically at the Weimar Institute. And for those of you who are interested in the topic of hyperthermia and whether or not a fever should be treated and the biological and biochemical aspects of that, I highly recommend reading this article, which is a good summary of the research. The authors conclude that SARS-CoV-2 is susceptible to elevated body heat, and elevated body heat also enhances the immune system. We thus hypothesize that frequent treatments of heat followed by cold are the effective first-line approach in the prevention and treatment of mild coronavirus 2 infections. We recommend for all stages of COVID-19 that the most accessible method of hydrothermal therapy interventions be used. We urge that this hypothesis be implemented for the prevention and treatment of COVID-19 while we wait for results from studies designed to test the effectiveness of heat to improve the immune system function and treat COVID-19.